very warm welcome to the first webinar from a series of webinars organized by IKP Knowledge Park. To begin with, I, on behalf of IKP, would like to thank all of you for taking your time in joining us for this very important journey. We are very pleased to announce that BIRAC and its partners launched the Amrit Grand Challenge JanCARE initiative to select and award 75 innovations in digital health, telemedicine, artificial intelligence, blockchain, and other technologies with the goal to reimagine healthcare delivery, touching 1 billion lives. IKP is honored to conduct a series of outreach webinars on the 6 focus areas of the call to provide insights to the kind of challenges faced in healthcare delivery and solutions that would be game changers. I am pleased to welcome you all to the first webinar of the series. We have an exciting list of speakers lined up today, and we will begin with an introduction to the program by Deepanvita Chattopadhyay, Chairman and CEO of IKP, followed by an introduction to the initiative by Dr. Manish Devan, Head SPED at BIRAC. We will then have 2 expert talks by Mr. Ivaturi, whom we fondly call as IVK, and Dr. Chattopadhyay, followed by presenting you a starter perspective by 2 startups, Mr. Akash Ganju from Saath Health and Mr. Tarun Gupta from SciCure MI. This will be followed by a very interesting question and answer session, and we would request you to please keep parking and posting your questions in the chat window, which will be picked up at the end of the session. And now, without any further delays, over to you, Deepanvita.
Thank you, Bindu. And a very warm welcome to all of you who are gathered here for our first webinar series. As Bindu mentioned, it's on health data collection, predictive analysis, and digital learning in medicine. Vishu, I don't have the share, or would you like to share my presentation? Because I'm unable to.
Sharing your presentation.
I don't have the share permission.
I'm sharing your presentation.
Okay. So is the screen visible?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes,
so my voice may be cracking because I think the internet is bad, but that does not prevent us from taking you through this fantastic challenge that we have launched with BIRAC and other partners. It's called Amrit Grand Challenge, JanCARE, Reimagining Healthcare Delivery, Touching 1 Billion Lives. You know, as Bindu mentioned, what we are going to do is select from all the applications we receive, 60 early stage innovations for ideation and testing. It could be from individuals, it could be from startups, it could be from academia, or anyone who has a great idea to solve and participate in the healthcare delivery of the country. And then 13 late stage validation stage innovations and 2 deployment stage innovations. And we look forward to great applications. The reason why we are doing this is we felt let's bring experts and people with experience to talk about the kind of problems and challenges that the healthcare systems and the healthcare delivery face in the country, and how do we kind of address them through your ideas, your solutions. Remember, the last date for application is March 31st. So, you know, we are talking of the National Digital Health Mission ecosystem, and at the center is the citizens and patients. And on the right side, you would see hospitals, all the healthcare providers like hospitals, TPAs, wellness centers, health tech companies, doctors, and other practitioners. And on the left side of the pie, you'll see that we are talking of government, both central and state government, the administrators, program managers, regulators, associations, not-for-profits, and at the center is the citizen, and the circle around that, the second circle, is the innovators and tech developers. That's you. So what the Unified Health Interface does is provide a techno-legal platform for protocols to link citizens and patients to the healthcare providers through the applications and solutions that you develop. So we are really looking forward to strengthening the National Digital Health Mission, the Ayushman Bharat Health Mission, digital mission that the government is putting forward. So what we have, the technology domains are digital health, mHealth, telemedicine, big data, blockchain, AI, ML, no surprises there. And the focus areas, this is very important, that when you put your proposals, the focus areas are access to primary health care, solutions for improving reach, because what we really want to make sure that the users of the technology are addressed. And then, of course, we are talking of health data, privacy, we are talking of patient compliance and data-driven modeling for pharma biotech research and innovation. So the timelines, we want the applications by 31st of March, and this is on the BIRAC website. Please register yourself and apply. And then there is a timeline from April 1st to July 31st by which we will review, shortlist, and select 75 applications. And the award, the D-Day is, of course, August 15th, when the awards will be announced. Anytime between August 1st and August 15th, but yeah, August 15th is the deadline. So what will you get? We have partners. We are actually onboarding more partners. What do you get from the partners is grant and equity funding, mentorship, clinical validation, hospital connect, pilot studies, industry connect, and follow-on funding. The initial funding that we are talking about is not, it's very modest, 10 lakhs for ideas, validation 20 lakhs and 50 lakhs for deployment. But remember, we are going to raise more money for the best solutions. So if you have solutions that really make an impact, we will ensure that you get funding for that. So the first one, the green one, is what we are doing. Remember, we will have 7 more webinars, and the dates are there. Register with us. And yes, we look forward to talking to you. I won't take much more time. I would request Dr. Manish Diwan, who is actually the anchor of the program. Manish is why he's so important here, and why do we need to really hear from Manish, Dr. Manish Diwan, is because he is, through BIRAC, he has framed the program, and we would want to hear the subtle nuances of the program from Dr. Manish Diwan. Manish, over to you, please.
Thank you, Dipanvita. I think thoda sa zyada ho gaya. So I think I am just one of the enablers, just like you, and not undermining the importance, relevance, and the contribution of each one of you. I think the overall objective of this program, if you look at why we have named it as Amrit Grand Challenge, AGCJanCARE, with a intended tagline that it can potentially reimagine the entire healthcare delivery in India, and it can potentially impact billions of lives. So this such mammoth objective cannot be delivered or implemented unless we have a collaborative partnering effort from enablers. I'm joined with my colleagues from BIRAC, DBT, the incubator network, IKP is Dipanvita is representing. Then there are 60 incubators for BIRAC alone. The large ensemble of entrepreneurs and startups from the country, the research institutions who are working in these aspects, the investors, the hospitals, the medtech industry who is looking forward that yes, bring us some innovation and some solutions, we will be happy to collaborate and come forward. And policymakers too, because such new solutions would be very helpful to get these integrated at national level and to get that so probably the JanCare challenge would provide that inroads to touch base with all of these important contributors for this potentially enormous initiative. And at this juncture, I would also recognize our Honorable Minister of Science and Technology, Dr. Jitendra Singh. He inspired BIRAC and DBT to undertake this initiative. So I think there is a lot of background effort from people to get few of you facilitated. Dipanvita mentioned 75 successful entrepreneur startups would get this opportunity of support through JanCare Challenge. But I would imagine that to reach out to identify those 75 best proposals, probably we would be looking at maybe 2,000, 2,500 proposals to be moved around across India. And that will help us and all of us, all of you also, to pick up the best possible solutions. The frame of this activity that has been proposed and being anchored by the implementing partner IKP, I think we will have these 6 dedicated seminars where we would be happy to hear from the experts that these are the gap areas or potential opportunity where we can perhaps identify solutions. And and in those solutions may be of various impact. Some solutions could be part of a bigger solution, and we could have many such solutions aligned in tandem to become a larger solution for implementation at the national level, perhaps. So such outcomes are also perceivable from this joint effort. This particular webinar is being focused on health data collection, predictive analysis, and digital learning in medicine. This would include solutions like image-based diagnosis, solutions that can help clinical decision support system. The hospitals can be upgraded to become smart and connected hospitals so that patient moving from one hospital for referral to another secondary or tertiary consultation need not carry all the documentation, all the files and all the reports and prescriptions along with them every time. If the data is current, updated, the hospitals can get connected and the data can be referred. Solutions such as for disaster management, early screening, tertiary preventions of secondary diseases, power to delay the disability or progression towards disability. So such decision support systems, solutions that can allow us self-learning or training solutions, solutions that are encouraging or enhancing the competition, predictive analysis, both at local level and global level. So there's a wide scope even under one particular theme. And I think the experts that we are all eager to hear, they would actually bring more insights and allow us to understand what could be the broader contours. And the few startup examples that are joining us today can help us that on face of it, when we are sketching a program like this, the real world may want to add some more insights, and we will all learn from that and build it together. So I am, on behalf of BIREC and DPT, my colleagues, we are very excited to bring this opportunity to all of you, and together the soft feelers that we are getting, the medtech industry, the hospital network, the policymakers, and the people who would like to nurture this in terms of investments and with follow-on funding, all of them are also excited that we are looking forward what evolves from here. So thank you very much, and we stay connected throughout the entire effort. Thank you. Back to you, Dipanvita and Bindu. Thank you.
Thank you, Dr. Dewan. That was exactly what we wanted to hear, the nuances of the call and of today's session. Now I would request Bindu, can you invite Dr. Vijay Kumar Vaturi, we call him IVK. He is the co-founder and CTO of Crayon Data, a big data analytics product company. And I'm not going to read his CV. You can check out IVK, but I think we're all waiting to hear you, IVK, about the challenges in the healthcare system that big data, AI/ML, and analytics can solve. Over to you.
Thank you, Dipanvita, and I hope you can all hear me. So thank you for inviting me. I'm going to share my views. I don't plan to use any slides, but I share my perspective based on the vantage point I hold from an engineering data science model perspective, which is technical, from an investor ecosystem perspective, as you see from a venture perspective, and also from my interactions with the healthcare community or healthcare sector, whatever signals I picked up. So this is a mix of, you can say, my collective learning in the last, maybe for the last couple of years. But since I have titled the topic as AI/ML trends and challenges, let me first start with AI/ML. I know it is a short talk, so we cannot go into a masterclass on AI and ML. But for all practical purposes, the way the term AI/ML is used in a popular science way actually includes many technologies which are not exactly AI/ML. But we will live with that, and because it's a holding term to cover many technologies, we use them as AI/ML, but they may not be same technically. So I would say that as it is used today in the industry, including healthcare, we cover image processing, which is actually quite widely used in healthcare. Text mining, we may not be using text mining to the extent people use in legal analytics, for example, but you do use them. Statistics, in fact, statistical machine learning to be precise. Linear programming, graph theory, and a lot of other areas. Nowadays, I hear blockchain. I think very soon we'll also hear quantum computing as one of this. But whatever is the term picked here, they all encompass a set of technologies which help us interpret data and perhaps predict it. So I'll go into a little more detail from other sectors, which are typically the major users of each of the methods before I come to healthcare and what differences I find. So the text mining, which is analyzing documents and figuring out the topics, the words, and what do they represent, like news items, for example, or analyzing a prescription. The classical text mining is heavily used in legal analytics for contract review, as an example. There are many techniques. I don't want to go into each of them, but the terms like latent semantic analysis, LDA, are the popular ones. You come to biotech, image processing is heavily used. Most of them use the tools like TensorFlow, which is a very well-known item now, like PyTorch otherwise. If I come to IoT or manufacturing sector, to be precise, you use AI, ML, statistics, but also use a lot of signal processing. Primarily, I would say edge computing, if you want to look at architecturally. Traditionally, the most popular use has been on fintech, which is your BFSI segment. While they focus a lot on segmentation, classification, etc., they also do prediction of risk scoring, maybe for lending, loans, etc. But these are the popular techniques, which are, I would say, maybe 60% of the industry is essentially in the fintech for these areas. Blockchain is another example. When it comes to retail, which we now call e-commerce as more popularly, you also use a lot of other things like clickstream analytics, which is based on your traversal, which is actually a graph theory based problem. It's not exactly ML, but you can mix it with ML. When it comes to logistics, for example, we use again route optimization techniques, which are geospatial. What is the least cost route? What is the fastest route, etc. So these are the techniques or methods. Some of them cover ML, most of them cover AI. Now most of them cover big data and a lot of other areas, topics. In my view, in healthcare, if I have to make a call, we actually use more AI than ML, if I have to be a little more fine-grained. As many people know or may know, all ML is AI, but all AI is not ML. So this is something to remember, because in healthcare, we find that heuristic-based decision-making or adding weights for decision-making on prediction or risk is quite prevalent. In the olden era, or maybe a few decades ago, we would have called them expert systems, which is AI. Now, coming to the healthcare in specific, now I'm going to pick something about what I see with respect to the data sets. It is a very good question to ask whether the techniques used in AI ML, in its broader sense, are they any different when you want to apply them to healthcare? Or is it just the data which is different? So let me just pick a few points on the data side. If you come from a fintech sector, where you have done trade analytics, stock market, loan origination, which is essentially on your financial data. The data sets you see in healthcare, which most startups today work, are actually very small. So one of the surprises a data science person will have, in fact, a shock to say the least, that they're really small data sets compared to what they would have used. The other factor you come across a little unique in healthcare is the metadata influence or exogenous data, the data which is outside of the field you are looking at, has a lot of impact. The third element, which is again unique, mostly for startups, I would pick maybe the first 3 years or 5 years of the startup journey. The difference between the training data set and the validation data set is very small. It is more or less the same, actually. So it is difficult to find validation data sets which are different from training data set, and most of the validation data sets come from abroad most of the time. So this is one of the unique things or specific, I would say, irritants sometimes. Is the validation different from training at all, right? This is the question we always had when we review some of the startup models or their data science models. Now, data privacy being common to many other sectors as well, mostly in fintech as well, there is an extra thing in healthcare, which is biosafety and the other protocols to be followed. So I think that makes the degree of complexity a little higher, than simple data privacy or disclosure or consent. As an investment community or investor perspective, if I have to pick healthcare, the exit models are a little more complex compared to the other sectors, for the simple reason that one, the validation is a longer process. Second, it is also regulated. There are a lot of compliances, and the people who provide exit are also very few players. So I think while it is changing now at the moment, traditionally it is a sector where you don't know where you will exit to if I invest, right? So I think these are some of the things which someone has to remember when you operate in healthcare sector. From an architecture perspective, this is the IT architecture perspective. Because many of the startups focus on the diagnostic side of it, you can say that they mirror an IoT architecture for all practical purposes, except that the acquisition device is a medical device. However, you also have the similar problems with any IoT system will have, which is basically on architecture of edge, fog, and cloud. What gets done at the edge, what gets done at the cloud level. The unique feature again in healthcare I find on data is the signal conditioning and signal processing of your biomarkers or biosignals, which is a bit different, including its interpretation when you deal with healthcare. So with this, opening remarks, let me look at 3 elements I find as the trends as well as the challenges going forward, which is maybe a good stage for anyone trying to build solutions in this area. Since the topic for the program is quite wide from a technology perspective and the application perspective, I have also picked things which are a little more common rather than being very specific to a certain area. It's an interesting question to ask, and if you focus on, for example, astronomy, the typical question, the overarching question that is often asked is, are we alone? Are we alone in the planet or in the universe? What is the equivalent question for healthcare? If I have to take a guess, I think the quickest or perhaps the toughest question to answer is how long we live, right? What is the prediction of your life for a healthy individual or a person infected with a disease or with any other disorder? So the prediction of the mortality or survival rate is an overarching question in many of the healthcare systems, more so in public health, because all your policies, fund management, insurance, care are all driven by the way you model this. But before we get into a higher level discussion like that, let me put a question in a little more direct sense. Is there a difference between a doctor or a healthcare expert trying to build a solution which leverages AI/ML, and is that very different, the approach different, from a person who did maybe similar solutions, say in fintech or in edutech, but trying to expand into healthcare, versus a person or an agency which worked a lot on customer experience and now they want to change it to patient experience? So if the starting point and the starting profile is different, will the solutions end up differently? It's a very interesting question to ask on how the systems evolve. Now, actually, my answer is yes, it does. The reason is this. If you look at a reference model for a healthcare system, in a slightly more formal model, we typically refer to a clinical data architecture model. In a clinical data architecture model, there are only 3 views which are typically modeled. One is the asset side view. That is hospital, beds, pharmacies, stock out, stuff like that, which are all the hard assets. Then the other side is the patient side view, which is basically wellness, care, post-care, etc. Then you have the clinical side, which is the treatment side or the SOPs for disease management and treatment. In the healthcare sector, if I hazard a guess here, the asset side of the management is very similar to an ERP system. That is the reason why in most healthcare systems today, the most commoditized solution is actually the healthcare asset side system, which is basically the health side ERP, the way your hospital ERP systems work. They are very similar to many other asset management solutions. Whereas on the clinical side, it is prescribed by the standard treatment protocols, which you have to comply with, or at least find why the variance exists. The models are almost prescribed. On the patient side, it is about experience and community and support networks. So when you build a solution into a sector like this, it makes a big difference from which side you entered, right? So most startups, as I see today, I find them focusing on the diagnostic side, on the clinical side to add on, because the remaining part of the asset side is pretty much available today as a SaaS platform or as a inbuilt platform, in-house platform. There are also trends in the advocacy, patient side, privacy, etc. on engagement. So in other words, I find most solutions in AI ML are on the diagnostic side as point solutions which go into the system. So the data side of system, if you look at the clinical data models, they rely on three things, which is a common identifier. So harmonization of these data identifiers or records, like a national ID system, is one of the big trends, right? So in fact, integrating with the national ID, which essentially means that you need harmonization of data models and also data architecture and data dictionary, so that the nomenclature is standardized and normalized, is something which I'm yet to see. I think it will go forward in this direction, but still I find that there are different data islands. Even the nomenclature is not the same. The second one on data side you have is the clean records. The records sometimes, actually most of the time, need a lot of cleansing. And when you integrate many systems, you really don't know the data quality. So I would say that that is another area I find as we evolve into a system level models, the record quality matters. There is, of course, a slightly more ideological and maybe a policy debate on should health data be immutable? That means, will it be a system of records which lives forever for a person, whether with the government or with the person? So this is the immutability is a debate on bioethics versus a lot of other stuff. So on the data side of things, I would say, if you are building a new solution, please focus on the data dictionary, the nomenclature used, the features expressed in terms of records and fields, whether they follow any reference data model. I think it makes a lot of sense to comply with what is coming up rather than use something proprietary which cannot integrate with other systems. The follow-up point on that is, which is my second point, is on the integration with larger healthcare enterprise systems. As I mentioned, the reference data architecture assumes that your point solution eventually integrates and delivers into a larger system. So this is very similar to the enterprise integration problems we used to face when the initial computerization started in other fields, like banks, for example. Now, I think here is one maybe a comment I would like to make, that while there are many projects or startups focusing on point solutions, on diagnostics or prediction models, I don't see any startup, or for that matter, any program focusing on the integration of systems. I don't think we should just assume that if I have just a JSON file and I use REST API, it's all done deal. I don't think it works like that. So I think maybe the integration side of healthcare is something maybe the agencies from the policy perspective and from the ecosystem perspective, one can really look at. And maybe we should fund one or two ventures on the integration as a proof of integration model rather than proof of concept alone. Coming to the third one, which is my major point here, is how the algorithms work or don't work when it comes to healthcare. Now, in my opinion, a lot of AI/ML models used today, they are primarily influenced and in fact very much driven by the heuristic models. That means expertise driven. The data discovery models are not as high as I would expect them to be, and it's mostly a supervised learning, to put it bluntly, which drive many solutions, while initially they would have done a discovery. The other point I would make is across multiple solutions, when you try to integrate it, from a pure signal processing perspective, if you're using devices, we are not sure what signal conditioning and processing and transformation you have done before a processing function or an algorithm is used, because all AI/ML algorithms work on linear algebra, essentially ones and zeros. So somebody transformed all your analog signals into that number. Whether it is any standardization there or there's any other weightages you used, we really don't know. As an example, I don't know what sigmoid function you used in neural network. So it changes everything, right? I don't know what features you extract. On the social side of data, not the clinical side, but the social side, I'm yet to see how we account for the socio-cultural differences when it comes to healthcare data disclosure, data collection, and even the risk scores on healthcare based on the region, ethnicity, etc. So I think that is another thing which I'm not sure whether we have looked into. To put it in a more philosophical sense, I would say the difference between fact, perception, and belief when it comes to data collection, data models, what is shared, what is not shared. I think those are some of the things which maybe need some consideration. As opposed to consumer experience in retail, for example, which is well researched on anthropological and behavioral science perspective, whether we have a similar research on the data side and disclosure side of things in healthcare, maybe that is something we can explore. And it's also a kind of a minor gap, I would see. From an algorithms and data science models perspective, most of these solutions use more than one algorithm, right? They're ensemble. It's always a mix. So the questions which are generally asked on explainability, availability, discoverability, the data bias or the algorithmic bias, I would say, and the model drift. These are some of the elements which take into account the temporal side of data as the time progresses, semantic data. So I think many of these data-related, model-related drift is something I would say needs scrutiny. And perhaps there's an opportunity for testing for such things. So not all startups need to focus only on functionality side of things. They can also focus on robustness and integration and stuff like this. So maybe those are some of the things I would pick up as opportunities. If I have to take a kind of a crystal ball and add one more area, which is not listed here, but what else I see coming up in maybe in the next 5 years or so, at least 5 years minimum, is things which are coming from quantum computing era, like quantum sensing, where you can look at fine-grained diagnostic models. I don't think it's a startup. It's more a research area, I would say, at the moment. But I think quickly it will become an area of opportunity. In its full glory, quantum computing must be able to simulate a full system, which we are far away from it now. Since a body is not just a summation of all the organs, simulating a human body and model it for its behavior is not a trivial subject. So I think that is something which will come up going forward. As a closing remark, I would say, I think BIRAC help here in terms of grants and nurturing the ecosystem is very much required, especially when you want to look at multiple aspects, like I mentioned, and stitch the solutions together and then help evolving the system in a fully integrated way. So I think those are my top level comments. Happy to take questions at the end of the session. And I will pause here and hand over to Dipanvita.
Thank you, IVK. I think the perspective you give must have stimulated the speaker, the audience here, to think in terms of what are the opportunities in terms of data-driven solutions. The integration, as you mentioned, is one of the most important areas. And if you look at how the digital transmission is working, it is about providing an integrated model. So that will go as a very important area. Thank you for your talk. Now I would like to invite
I think Dipanvita is facing some internet issues. Dipanvita, you there? No problem. I think I'll present this part and wait for her to come back. So our next expert speaker is Dr. Shibaji Chattopadhyay. He is a trained intensivist and currently serving as the Group CEO of Cancer Centers of America. He has 15 years of experience in managing healthcare in different leadership roles. And in his current role, he is setting up a 15-center cancer network chain under the name of Cancer Centers of America, spread across 6 states in India. Dr. Shibaji, over to you. Oh, Dipanvita is back. Sorry, Dipanvita, we missed you.
This is absolutely fine. As I told you today, somehow the internet connection is patchy. So perfect.
Sure.
Dr. Shivaji, over to you.
Thank you, everybody. And first of all, thank you for inviting me to speak on this forum. Now, overall, I have a slightly different view, and coming from a hardcore healthcare background, yes, the way forward is what we are talking about is lot of digitalization, but I would say that healthcare is slowly a concept of more of smartness. So I would really like to start with one thing is when I was in Harvard and we all keep talking about digitalization, data and everything. Healthcare has been the most underprivileged sector where this digitalization has hit the last, especially in countries like us. In developing countries, it had came quite before, but we were quite underprivileged. Now, since this is a forum which should encourage startups to look into this aspect in healthcare, the positive side of it is there is immense potential in healthcare, because we are moving into an era where hospitals or healthcare units will talk to each other. And that's how when we run groups or a chain of centers, one thing we always talk about integration. Now, as my previous speaker was telling about AI and ML, yes, there are a lot of ERP solutions which has evolved, and yes, we are being using a lot of ERP solutions for management decisions, especially in terms of the asset management, as I said, the revenue cycle, the inventory management, all those things. I would request startups really to focus on the clinical aspect of it, where I, as a clinician, as an administrator, I face a big challenge in that we have to rely heavily on EMR solutions, which will be the next frontier now. Now, if we talk of digitalization, it will be totally incomplete if we don't have a robust EMR solution. Where I feel there is a lot of potential to go about with it. Now, there are bits and pieces works which are going on in EMR, but if we really can have EMR solutions based on a specialty specific, which can integrate into a mother EMR, then this topic of information flowing from one center to another center is possible. Now, yes, like large groups, we have integrated our EMRs or our software from one location, but with the vision coming in where there will be national grids on diseases. If we don't have a EMR which picks up this data, scans it and puts it back into the usage, which will again as a reverse cycle come back to the startup platform to use it and refine it. There's one place I see where there's a lot of potential for new startups to work with. Now, to do that, yes, you need a platform. We healthcare providers would love to help you all out in enhancing the EMR models. That's one part I will always bring into the discussion. Second, there's one big aspect which we all miss out when we talk about the next frontier in healthcare is I would want, if there are really some good startups, to work into the digital biomedical aspect of healthcare. Now, what do I mean? See, what do I mean? See, there are a lot of innovations which are getting evolved in the biomedical aspect part of it. For example, we use a lot of medications are infused through pumps. Correct. Now, those pumps, we find a lot of pumps are gadgets which give medicine at a stipulated rate over a period of time. This is one area where I think startups can work on integrating it with the main EMR solution. That's one which has been lacking. There are patient monitoring is one part where I think a lot of startup could work in, where if the startups can work in, we can bring that into a level where it can go to the primary care base. Thirdly, yes, we are looking into a space where during the COVID time, we saw the use of, I will use a very normal term like robots, correct, in medicine delivery, but that was very, very primitive, correct. There are scopes where a few of us, when we were in our B school, had that thought that, okay, why can't there be a methodology where medicines can be given at a bedside by an X platform where the medicine errors can go out. There are scopes still lying in medical furnitures, right? There are scopes like, why can't we have a digital bed? And it is a viable model. A digital bed is getting evolved in some quarters, some portions, correct? If that can be really worked on, it will help us in a big way, where a lot of care centers which cannot integrate, cannot have all the monitoring system in a monitor. If somehow we can have the basic monitoring available in a bed, this is one aspect. Now, since digitalization or the healthcare has always taken a backstage because of that issue of data privacy and data, like we keep hearing that term. Yes, there are some regulations, but I always feel that because of this issue, we have faced a lot of hindrances, and that's why there is data available, as Sir rightly pointed out. There is a lot of extraterrestrial data. There are a lot of data available in the clinical part of it. We can use it. And for me, as a healthcare person who is setting up these networks, I would really want to see systems which will make decision making clinically more easy. Now, management decision process mechanisms are available. My biggest hindrance I'm seeing, for example, I run a cancer chain. Yes, we healthcare runs on a lot of human interfaces. We need clinicians to make decisions, but if we have a robust system where the system provokes and tells me based on a patient's staging, based on what progress a cancer has made. For example, my PET report getting integrated with my EMR, and based on staging, what is the best molecule to be given at what stage of cancer? Like we are trying to integrate the NCCN guidelines with our software. So this type of scope is quite possible, and there is ample scope. So there has always been a saying that we work forward for a care plan mechanism, which somehow is not getting adopted in India in a very robust way, except in small bits and pieces, because we are not having an overall EMR. And I would request in this platform, if there are some good startups which are thinking of really working on the EMR aspect of disease-specific EMRs, right? There is ample scope and realization is possible of that. To support that, there will be industry experts and place and institute like us and many more facilities would really help you to experiment that in our ventures. So I want to keep it short because I don't want to load much of what data, how data flows, how AI ML is working in healthcare. But yes, there are some lacunae. There is some gaps in healthcare, but wherever there are gaps, there is opportunity also lying. So I would request in this that from healthcare platform, there should be startups who should look into these 3, 4, 5. One, if an EMR where there is ample. Number 2, the biomedical side of it, where we can integrate our patient monitoring system, our medicine delivery system into our platform. Number 3, if we can integrate our biomedical furniture aspects like the digital beds and everything. So in short, I would love to only express this. As the head of CCA and from the industry, we would love to have new startups coming up and working. And this is the need of the hour, where we are looking forward for solutions which are affordable, because healthcare doesn't sit in the metros. As I always say, healthcare has shifted to tier 2, tier 3 cities. And if we can't integrate them into the organized sector of healthcare delivery, we'll always talk about that gap between the urban and the rural in healthcare. So that's from my side, and over to you, Dipannita and anyone from IKP, and I'd be happy to answer any questions on healthcare, because I am from healthcare, correct? And I'm seeing what in healthcare we need, correct? So that's from my side. Thank you.
Thank you, Dr. Chattopadhyay. This was very enlightening, because it brought the clinical perspective, and that's exactly how we have tried to organize most of our webinars in this 8-part webinar series. We have a technology person and person with clinical background, and that provokes us to think more. So over to you, Bindu, and please invite our startups. We want to hear them now.
So after those 2 really amazing, enlightening talks, which provided a very, I would say, diverse perspective of the kind of innovations required in the healthcare sector, I would now like to invite perspectives from the different side of the table from startups. So first, I would like to invite Dr. Akash Ganju. He's the co-founder and CEO at Saath Health. And the mission of Saath Health is to build healthier communities using artificial intelligence-powered digital platforms. He has authored several peer-reviewed publications using digital technologies, machine learning to improve community healthcare. He's authored a book, which I am planning to read, A Glass Half Full, that emphasizes on the urgent need for healthcare innovations to meet the needs of emerging health consumers. He has won several awards, and without taking any further time from you, I present to you Dr. Akash. Over to you, Akash.
Thank you very much, Bindu. I need to be able to share my screen, yeah.
Yeah, please check if you have shared access. We have enabled it. If you don't, let us know. Yes.
Can you see my screen?
Yes, we can. Please go ahead. Thank you.
All right, thank you for that introduction. So I'm Dr. Akash Kanju. A quick background, I trained as a physician. I worked in the global pharmaceutical industry for about 12 years, and I've spent the last 10 years, I'd say, tinkering and learning at the intersection of public health, technology, and consumer empowerment. And I talk about my background because I bring, I think, multiple lenses to this conversation and why we do what we do at South Health. At the outset, let me just compliment BIRAC and IKP for this outstanding event. I mean, I've been a health entrepreneur for 10 years, and to see an event like this where we are actually going out and creating the fertile space for healthcare startups to dream, imagine, and bloom is absolutely outstanding. So my compliments to you. So I'll talk a little bit about what we do at South Health, and the lens you will see is slightly different. It really builds on to what IVK and Dr. Chattopadhyay were talking about, but it is a slightly different approach and lens that we take. So at South Health, we deploy AI-powered digital tools to personalize interventions and improve outcomes with health consumers. We are a B2C company, so we work with healthcare organizations to deliver precision digital health tools. We are fortunate to be part of several accelerator programs in India, including the NHA's Market Access Program, PATH's Primary Healthcare Tech Challenge, and IKP's DEEP program as well. Just a quick slide sharing with you things that I'm sure this audience already knows, but it really explains the context of why we do what we do. So healthcare, driven by increasing demand and limited health worker supplies, at a critical inflection point. And this was there even before COVID. COVID has simply accelerated what we think are four major trends. First of all, people are living longer, which is great, but they're living with more chronic diseases than ever before, reflecting a significant rise in consumer demand. We don't have enough doctors or healthcare workers to meet this demand. I mean, that's a fact. In fact, the deficit in healthcare workers is expected to increase over the next 10 years to 18 million. So increasing demand, limited supply leads to healthcare costs going up. As you will see, healthcare inflation in India is going up the way it did in the US for 3 decades, back to back. This is unsustainable for all of us. So these are some of the negative trends that we are dealing with. But fortunately, there is a positive trend that juxtaposes next to these negative trends, and that is that in the last decade, and especially in the last 2 years, there has been an unmistakable shift in the adoption of digital tools. Consumers want to participate in their own health journeys. So while we do need to invest in getting more doctors, more nurses, more healthcare workers, training them, giving them the tools to be more productive, to do more with less, health organizations are realizing that that alone won't be able to solve the problem. And what they are looking to do is increasingly address these health challenges using digital tools. So whether you are suffering from heart disease or diabetes or cancer, we now have digital tools that can reach patients, educate them, empower them, and help them make the right preventive health choices. And COVID has massively accelerated these trends, as we see even at our work. So at South Health, our focus is how can we make these digital tools more effective? How can we get them to do more by personalizing what they deliver to patients and health consumers? So we enable personalized precision digital health interventions using an AI-powered digital companion solution. Our digital companion solution is built on the foundation of 8 independent modules that power the user experience. We've tried to deliberately make this solution agnostic to indication and agnostic to geography. So we are working across multiple indications, as I'll point out to you earlier. And in all of these indications, some of them are primary prevention, some of them are secondary prevention, but patients receive a personalized, gamified behavior change learning journey. It allows them to earn points. These points can be redeemed for a variety of non-financial and financial incentives that drives positive behavioral shift towards pre-identified outcomes. What we're trying to do is to deploy these digital companions to make the journey, or the patient's journey, fun and infotaining, give them a reason to engage with digital tools even when they are feeling well. And that's really the crux of the issue. Most often we do a healthcare intervention when a patient lands up at a facility that might already be very late very often, right? How many diabetics go and visit their doctor every month or even every quarter? Most of them self-manage, and they have no reason to really seek a healthcare intervention. We're trying to use a digital companion to give them a reason to use the intervention even when they are feeling okay. So we are currently deploying our companion solution in indications as diverse as children's health, family health, neuropsychiatric disorders, and health worker training as well. The second set of solutions that we are building are AI-powered tools to personalize digital health interventions for health consumers. So we collected more than 15 million health consumer data points from thousands of users, and we use them to build scalable predictive model algorithms. Now, every user that lands on a digital health platform is not the same. They're all going to be different, right? And some of them are common variables like age, geography, indication, the level of risk, the severity of disease. And it's important that the intervention adapts itself to these variables. But beyond these variables, we also found that it's possible to segment health consumers into 6 digital phenotypes based on user behaviors. So, whether a health consumer is on our companion solution or that of any other partner, what we are really trying to do is predict user churn on digital health platforms. And we've published some work that shows that we are able to do that with 93% efficacy. We are providing AI-powered recommendations, just like Netflix and Amazon make recommendations to us. Can we make health recommendations that allow health consumers to consume content that is most likely to drive them towards the target outcomes and increase engagement with the digital interventions? So that's the second thing. And the third thing that we are aiming to do is being able to provide adaptive, personalized experiences to health users tailored to their digital phenotype. Patients are not static. A diabetes patient's journey is very convoluted. Same is the case for hypertension. They go through multiple symptoms, multiple changes, and your digital intervention needs to be able to adapt itself to the dynamic status of a patient's journey. What we are aiming to do is to use these algorithms to provide our customers with the ability to augment digital health engagement with health content and transactions, optimize marketing spends, because a lot of money is spent on reaching users that simply don't engage. There's huge churn. And finally, I think what's really most important is how can we increase the lifetime engagement with the health user? The more engagement we have with health users on any digital platform, the more likely we are to be able to drive them towards the positive health outcomes that we really need from them. We are a young startup. We started in 2019, but publishing is really important to us. So we have published our work on machine learning in several peer-reviewed journals globally, and we will continue to do that even in the coming years. We're now in the process of deploying our solutions for use cases that are very diverse. So we worked with low-income populations across India for maternal and child health, and we are currently launching a big solution for family health, which is funded by ACT grants. And these are low-income Hindi-speaking users. We are also using our platform for neuropsychiatric disorders, for health worker training, for family health, and for chronic diseases. The family health application that we're just launching is on track to reach more than 500,000 families across India just within 2022. So we are doing a lot of work in public health, and we think that there is for some reason, technology solutions have really lagged in the public health space. And one of the things that has really befuddled us is why technologies that are available widely cannot be made available even to low-income users. We think there is absolutely no reason that shouldn't happen. So we are very actively and consciously building our platform to be able to serve the needs of consumers, irrespective of their economic backgrounds, irrespective of the geography, indication, or the markets that they work in. So just want to end by saying that 2021 attracted more than $57 billion in venture funding for digital health. It's a very, very exciting time. The trends are extremely positive. I think somebody alluded to this earlier. A health tech journey is not a short journey. So I think be ready to sign up for the medium to long term, and medium to long term could be interpreted differently depending on where you come from. But health is not a short journey. It is a very exciting journey, a very exciting space to be in. And our goal is to help digital interventions deliver the precision personalized solutions that are required to provide for better health outcomes. Again, thank you very much for inviting me for this talk, and my compliments again to BIRAC and IKP.
Thank you so much, Akash. That was really inspirational. I think it gives a lot of ideas for new innovators, which is the whole purpose of having this set of webinars, to give an idea of how did you arrive at your problem statement, and how have you processed it, and what are scope for new innovators to come and break through. So thank you so much. We'll come back to you at the end. Moving on, Vishu, can I have the slide, please? Thank you. Our next entrepreneur is Mr. Tarun Gupta. He is the co-founder of Vaidya RX and founder and CEO of SciCure MI Healthcare Technologies. SciCure MI is a medtech startup which aims to develop an intelligent self-care product for patients to provide them personalized care using predictive analytics from their medical records. On the other hand, the other company, which he has co-founded, Vaidya RX, is involved in solving critical challenges of healthcare delivery in the Indian healthcare ecosystem. So, Mr. Tarun, over to you.
Thank you, everyone. First of all, good afternoon. And again, I would like to start with the deep sense of gratitude to the entire team at IKP. That includes Dr. Bindu as well as Dr. Ambuj and all other team members who have been associated with me for a long time and giving me this opportunity to talk to all of the audience about my experience, my journey, and not the least, to say the least, inspiring young entrepreneurs and innovators to be part of this challenge. And it's a huge responsibility, but I'm very happy to talk for next 7 minutes about who I am and what we have done. And more importantly, I'll not be using any slide, but I'll be sharing my own experiences, my own challenges, the troubles and the gains, as well as the learnings that I've had during my entire 3-year journey. To talk about my startup, so I have two entities. One is Secure Me and the other is into digital health, which is Vaidya RX, which is a new one about to be formed. In both these entities, we have been supported ably by BIRAC, DST, IIT Delhi, and many pharma companies, including Pfizer, Sanofi, and others. And I have been privileged to be part of a topmost US accelerator a couple of years back. And I have many other recognitions. Now, why I mention all this, not to scare you, but to motivate you. But despite having all these support systems, I think I would like to say that one of the things that have really helped me is my mentors and advisors. And now the topic I'm going to talk about is how it is important to actually identify the problem. And we have been working incessantly on clinical decision support tools. And one of the things which I have personally faced and have personally faltered is usually when, and I would like to also start with one thing, that I'm a technologist. I come with an engineering background, not with any medical background. And all the young entrepreneurs who are willing to start in healthcare, you can actually take cues from all the things, because one of the things that I have realized that when you are working or in the field of healthcare, it is extremely important, and I will say this umpteen times during my talk, to talk to the real customer. Most of the times I have seen people in my team, including myself and other startups, they have started building solutions and for which the problem would never existed, or it was a fiction in their mind. So one of the most critical thing that I have realized is to actually spend as much time talking to the real stakeholders. In fact, I would like to tell you that whenever you will go and present to any organization, be it BIRAC or any large institution, the first thing they check is your team. The reason they do, which I realized much later on in my life, is that if a technologist or a business person is solving a health problem and they do not have right individuals in their team, then they know by their own experience, which I have now realized that it's not going to go far. For example, in the first venture that we have built, we are building a clinical decision support tool to actually provide solutions for diabetes and hypertension. And so one of my first step, which I did when I had actually gone and sat with doctors at All India Institute of Medical Sciences and spoke to a lot of endocrinologists, cardiologists, the first problem they told me was that when patients walk up to us, we only get to see their data momentarily, which means that we only get a snapshot of their data. We look at their blood pressure once, we look at their BP, their glucose once, and maybe their medical records include LDL, HDL, triglycerides. So the next question that I asked them, so what's the challenge and why you want technology to solve them and why you are not very happy with the current solution? He said the answer they gave was an eye-opener to the solution that we have built and we are building on. The answer they gave, the problem is, Tarun, that the momentary data is not sufficient. So my next question, so what do you want? So they said that 99% of the time when the patient spends outside the four walls of the hospital, and we just get to know only from 5 minutes, and any decision based on 5 minutes is not very useful. And a condition like a chronic condition like diabetes and hypertension needs to be monitored over a long period of time. So why I gave this example is, even if you talk to all the entrepreneurs, people will talk about technology, people will talk about AI. It's extremely essential to really go and sit. Till date, 2 hours in a day, I literally push my team to go and sit with the doctors and observe them. Most of the times we are building features which doctors do not require. We are building solutions which problems do not exist. We are solving problems where doctors will never going to use it based on UI, UX. And one other point I would like to tell you, in VaidyaRx, you will be surprised to know by sheer power of observation. I repeat, sheer power of observation. We are working on a product which has won accolades for us. And in fact, we are building India's largest and of course the first follow-up care digital health platform, where one of the problem that we are solving, which somehow coming from a doctor's family, I didn't see it, my peers didn't see it, is I realized while standing outside in heat next to a chemist and a doctor, where I realized 90% of the population in India, well-read or poorly read, do not understand the prescription. And it has a challenge which is bothering our population for long and has led to mortality and morbidity and many other things. So without delving much on what we are doing, but when I was requested to talk on it, and I was extremely excited because this is a very interesting challenge which is going to help healthcare delivery, and 75 startups are going to be selected. And if any of you can actually save the time on building wrong solution for a wrong problem, I think that will be, if my talk or my learnings can be helpful, it will be important. So just to summarize, I would like to say, spend as much time as with stakeholders for which you are solving problem. Do not hesitate to learn their ropes, in the sense, learn their language, spend time, and also keep yourself extremely alert, observant, and more you spend time with the real users, the solution will come itself. And when after that, when you will build a solution, it will become a solid business case. Last but not the least, in most of the presentations, you will ask people reject you because you do not have a solid business case. Now, if you're spending 2 years or even 2 months on a problem which has not a good business case, then it's not worth it. But again, when you are solving a problem which exists and for which people find value, they will pay for it, and the business case will definitely arise. So these are my 3 learnings that I had over the last 3 years after going through rigorous training. And I hope these learnings can be helpful to you guys to come up with a solid business case and hopefully become part of the 75 startups. All the best, and happy to take questions. Looking forward for any queries later on. Thank you so very much.
Thank you, Tarun. That was very helpful and practical, I would say. And now I think we have 10-12 minutes left, so I'll pass it on to Deepanvita for question and answer sessions. Deepanvita, over to you.
There are, as usual, when we have a good presentation, when we have a set of good presentations, there are also questions in people's mind. So there are a large number of questions. What I'm trying to do is actually take a few and Bindu, can we go back to the screen, because then okay. So one is question is integration of, this is for Dr. Shivaji Chattopadhyay, integration of centers. Integration of centers run by a single mother group is different to integration between hospitals where real-time data sharing is required. My question is, what would be the kind of innovations that would be required to fulfill both these unmet needs?
Okay, it's a very subjective and a broad question.
Yeah.
Because as we said, in healthcare, there are different scopes, like there are certain data which is used for the ERP solutions. There are certain data which is used for patient-centric approach, and there is certain very specific to clinical approach. Now, I'll start on all the 3. Now, the ERP solutions are more or less standardized, right? And it's very easy to integrate between different locations of a single chain. And if that data, I feel, is not very important to flow from one group to another group, because there are some business decision data which is sitting there. Second and the third point related to patient-centric and clinical-centric. Now, clinical-centric, what happens is, like if we have innovations in care plans or care paths, right? That helps not only a single entity, but it helps on a broader platform also. Now, that innovation in care plan can help in a multi-center unit within a chain. You can easily integrate it, because if you have it integrated with the EMR, I can use it. Similar thing, like there are like-minded, as you remember, I always said that data privacy has been one of the major hindrances in healthcare, which is more, I will say, of a mind block, which doesn't allow clinical data or people doesn't share. But with a lot of consolidation happening in healthcare, with big groups merging with small groups taking over big lot of things, we can easily have work going on in care plan. Now, as of now, yes, bits and pieces works are happening into the care plan platform. That's one place we can easily, because care plan is such, it takes up data, devises a path, and refines it, keeps on refining it. And if we can have solutions based on specialty specific, I don't see a reason why it cannot be shared. I am a person who believes in that school of thought, that data security, the lacuna in data security, they try to camouflage it by the word of data privacy. Correct. So that's one. Second, patient-centric data can easily get moved. If we have a solution where, like we are thinking of national grids in oncology, where a code is given to a specific patient who can log into that code at a specific hospital for a cancer. The patient records can move. Now, why people don't do that? Many times we have that mind block that whether are we giving the right treatment. But once we have a care plan and a care path, the information or the data can move from one center to another center in the same group, and groups can also share, provided we overcome this mindset barrier of data privacy. I don't see any reason why a clinical data cannot be shared for a patient's benefit just because some data can be misused or anything. So,
so we'll just pass on to some other questions, Dr. Chattopadhyay. I'll just jump to a question from the consumer side. So what's the response of digital health products by consumers? The clinical point, the clinical view of products. So whether efficacy, I guess the question is on efficacy. So our digital products, are there any trends that would help people understand whether digital products are accepted in the market? So who would respond? Yeah, Dr. Chattopadhyay.
So that was for me, Dipandita?
So for anybody, but there's no specific, yes.
I can take that and I can share. So about 7 years back, there was a huge amount of euphoria in the industry that, digital health aa gaya hai, now we'll launch an app and everything will be solved, right? And I think that settled down. And what we are finding now is that the same organizations, they continue to be optimistic about the future of digital health. They're just asking smarter questions. So I think there are definitely models of digital health interventions that have shown efficacy outcomes. There aren't that many, but there are more and more coming through. And I think more importantly, people know the questions to ask now to demonstrate the efficacy. And the incentive models are in place, Dipanita. So there are regulators and who, from a pricing perspective, are putting the incentive on the table and saying that if you're able to show these outcomes, this is the pricing conversation we can have. So we've matured a lot.
Important that consumers are maturing, the market is maturing, so there are smarter questions, and probably the products will be, we can only expect better products.
Absolutely.
So fantastic. IVK, there's a question for you. What are the open source software suites available for modeling of the data trends? Is there anything that you would?
Well, there are many available, so I do not put any specific recommendation as such. But I can tell you the popular view. I think in the last couple of years, the standard, the way it is supposed to work or it is working today, in 90% of the cases is the person who actually codes it will be somebody who knows Python and they know what package to import. They may not know why they chose a method, but they can try many methods without any cost. So they will say, okay, Bayesian classifier works, let me use Bayesian. So whatever your team is comfortable with, I don't need to take a call on is it TensorFlow better or PyTorch better, Python versus Scala. I think the tool chain can be picked up. The only point I would make is pay more attention to the way you pick a data model. If you are complying with some standard. Second, if you are picking something, a model or an algorithm, just make sure that you know why you picked what you picked, not because you just know it. That's what I would say.
I would like to add one point which I have realized through my own journey is that data modeling is good, but we really need to focus on actionable insights for a clinician. And most of the time, startups miss that last nugget, that golden nuggets that doctor do not have time, but then to just see one key actionable insight out of the myriad of data. And we should just keep our focus on that. Thank you so much.
Thanks. So there's a question for IKP and I guess Bairat. So this person is saying that they have a product for easy access to digital pathology. The POC will be ready soon, and by August, their prototype will be ready. Which level they should apply for? Is it for the advanced stage validation or is it for the POC? Because when they put up the proposal, their POC will just be ready and probably their prototype will be ready. So, you know, what I would request, I don't know the person, but you could write to us at AGCJanCARE at ikpknowledgepark.com. We could just see and then provide you a little more insight on which stage. But it's a good question for everyone. How do you choose whether it is the POC? Actually, if it's POC, you don't, it'll be TRL 2, 3, that kind technology readiness. You have a great idea, a little bit of, you've done a little bit of need identification. Maybe you have a dirty prototype and MVP may not be fully ready. That's when you are still developing the proof of concept. But if you really think you have a product that will be validating by August, but your proposal should be able to support that. If you propose, because you'll be judged not by anything else, but the proposal and the presentation you put in. So I would just say that. So since we have just a couple of minutes left before closure, I was thinking, Ambud, you had a few short questions. And would you like to ask these questions or should I take it up? So for IVK, there's a question, are there opportunities for marketplace type of solutions, aggregators? Are these big player games, or can startups also play in this space, and what kind of opportunities for startups?
So maybe I will give a comparison with a lot of other sectors who do similar stuff, and everybody collects data, federate it. I think the key is, maybe I'm not aware of any such agency in India for us here. In many other sectors which are highly regulated, whether it is fintech, whether it is airlines, whether it is any other funds, what I find is when you have a federated data, you will solve the problem of the basic training data set, etc. So somebody has taken care of anonymized data model, etc. So that the people who are innovating can work on the model and the insight rather than cleaning the data. But then they also have a very good agency or a forum which will make sure that this governance works and the integration milestones are met. I don't want to name the chains here, but I'm involved with a couple of hospital integrations. It is not a trivial thing to just integrate the systems. On paper, yeah, they will say what is there, it's an API call, etc. It never works that way. So it becomes very hand-coded to integrate for every scenario, for every system. So if we run an ecosystem model, I would think that an equivalent of what the DOT testing used to happen in telecom, we may need such test and harness model for integrating these solutions. I think that will be a great help for the ecosystem. A related point I want to make is that in India, we are not yet very clear in terms of law on data privacy, more so in its interpretation. The current view is that the privacy laws apply differently to government sector versus non-government. Whether public health with a private player is in which domain, we don't know. So I would say that that is another area where, if you ask me from an AI, ML or tech model perspective, either we are underrepresented in data or we are overfitting the model. This is what happens in most solutions, because the physician or the expert will keep telling the coder, the developer, saying that I need to see this at 60. So they will do the model to make it 60. So your weights will change to make the number they want to see. So it's overfitting. Or you will have 500 records on which you run a machine learning algorithm, which I can do on a spreadsheet actually. So I think this is where I think an integrated approach will really help. So a federated data model and a test and harness, which is a common service to all the startups or even big companies, will be a great addition.
Thank you so much. Working on that, by the way. So we'll catch up offline.
So there is one interesting question because we are running short of time. is there a scope for a consortium of startups to collaboratively apply for the grant so that a complementary comprehensive solution can be deployed to solve a problem? I'm sure there is. I think if you can put a consortium of startups together, and there has to be a lead person, because ultimately the grant will come to a lead organization, and then it goes to the other partners. But definitely that is possible. But you have to define who leads the program, and in the application there has to be a PI.
Dipanvita, if you allow me.
Yes, of course.
Yeah. So I think this situation would arise, and this is a practical issue. We can expect that, as I said, that many solutions need to be created in order to create a practical, usable solution. So in that case, many such many solutions can work in tandem and complement each other to evolve a clear, larger solution for all practical purposes. Now, one way is that such group of people come together and apply as one team to make that happen. But you would also realize that in case one of the element misfires in such proposal, then the entire piece fizzles out. So in order to secure that at least one individual piece, standalone piece delivers and gets executed, you may want to have such pieces individually applied. And if it is at early stage, then I think that provision is there for ideation to POC level. And then there are a larger number of opportunity there. So you can avail that. In case the POCs are already there for these individual mini solution, I think at that time it would be more appropriate that to stitch them together, you are putting up a combined proposal, and that would actually enhance the outcome of the individual solutions to become a more impactful solution. So at that time, you must come together and explore the opportunity. So I thought, thanks, Dipanvita.
Thank you. So hope we've answered your question. And yeah, since we are running a little out of time, we will close the meeting now. But remember, we have 7 more webinar sessions. Each one will be deliberated on by our partners and expert speakers who have seen the journey of digital health or the healthcare system and know the challenges in the healthcare system. Keep in touch, prepare your proposals well. We look forward to having wonderful proposals so that the best solutions win. Thank you. Thank you very much. And thank you, Bairak. Thanks, Manish, and I saw Utkarsh there, and Shubhro, and all others who could not be here today. I know Dr. Shishendu will come on the 15th, and all other partners. I have to thank all other partners because they have agreed to be part of the various webinars. And I thank the IKP team and the speakers, and a wonderful time. At least I enjoyed the session so much. Thank you very much.